Did you know that a mental health diagnosis could actually make it harder for you to get life insurance? Unfortunately, there's a lot of things that people just don't know about when it comes to using your insurance for your therapy. Now, you'd think, well, I have insurance, covers therapy, or at least some insurances will cover therapy. Why shouldn't I use that? Well, the primary reason for that is because if you use your insurance for your mental health therapy, you have to get a diagnosis. And that diagnosis goes on your medical record and is then accessible by other insurance companies, life insurance companies, health insurance companies, can even be requested by future employers depending on what the situation is for the job, and it can actually make it so that you're not eligible for some jobs. At any rate, let's say you go see a therapist because you're struggling, you've been stressed out about something, and ultimately get an anxiety diagnosis. No big deal, right? One of the most common diagnoses out there, anxiety, right up there with depression. Unfortunately, it's looked at a little bit differently by life insurance and health insurance companies. Now remember, insurance companies' jobs are to help you to be able to pay for things that you can't pay for yourself, but also they have to be able to make a profit so that they can pay all the people that work for them. They're a business. Now, not all mental health diagnoses are going to be an issue for insurance companies, but I'd say the vast majority of them will have some sort of an impact. At any rate, when you use your insurance, you've got that diagnosis, and a life insurance company comes along and they look at your medical health record, they will see, let's say, that anxiety diagnosis that we talked about. They will go, okay, anxiety makes somebody more likely to have medical problems. Anxiety often leads to everything from headaches to ulcers, you name it. There's a lot of things that can go along with that. So their health is more at risk, which means that their overall lifespan is more at risk. Through personal experience, as well as through other people that I've talked to, I've known a lot of people who have had this issue where their life insurance is more expensive and in some cases unaffordable because of prior mental health diagnoses. Now, I don't have time in this video to go into all the different ways in which having a mental health diagnosis on your permanent record could affect your life. So if it's at all within your control, why would you want to risk it? Unfortunately, a lot of therapists, a lot of doctors don't do a great job at informing their patients, their clients, what they risk when they do get a diagnosis. And a lot of times, we don't even know what that is. A lot of times it depends on insurance companies, depends on a whole host of different factors, and it's constantly changing. But I want to make sure that as many people as possible know, be careful when it comes to paying for your therapy with insurance. One thing I want to point out is if you have a child that you are sending to therapy, especially if you have a child that does not have any prior mental health diagnosis on record, if I were that child's parent, I'd want to keep it that way as long as possible so that they don't have to worry about, because of one of our decisions to use insurance for their therapy, that they down the road have to pay more for their own insurance as an adult, or that they have a problem getting life insurance. So if at all possible, try and pay directly for your child's mental health care as well as your own. There's a whole host of other reasons, like increases motivation, outcomes are better when we pay personally for our therapy. There's a lot of reasons to do it otherwise, but just consider this one possibility when it comes to keeping your mental health private from insurance companies and from others.